Good morning, friends. David Wright here, and I am your host of the Disruptive Innovators, Champions of Digital Business podcast. And this morning, I am delighted to be joined by Dr. Paula Ferrada. Paula, it's a pleasure to have you on.
David, thank you so much for the invitation. The pleasure is all mine.
Absolutely. Um, for those of our listeners who may not be familiar, and I know I could see it in your background here, but can you tell everybody a little bit about your current role, Paula?
Yeah, I am the Deviation and System Chief for Trauma and Acute Care Surgery for Inova Healthcare. Inova Healthcare is a right now comprised of 5 hospitals in Northern Virginia. And in 2 of those, we have trauma programs, hopefully soon in 3 of them. And that is what I do administratively. Clinically, I'm a trauma and acute care surgeon. Um, so I'm really proud that I never actually gave up my involvement with patient care.
Yeah, I think it's it's really cool. So you're still actively a surgeon as well then. Yeah. Um we, we we've had a few guests over the years that um are have taken on more executive or leadership roles within health systems, but then are still practicing. And I've found that it creates a degree of compassion and empathy, and in leading, right? It's you can kind of go over there across the line and kind of really create that identification and help people see what you're trying to do. I think it's really, really cool that you're still doing that.
So one of the many advantages, right? If you're gonna lead people that work in healthcare, it's really hard to lead them if you cannot start leading them by example. But I also think that the capacity of helping someone, particularly in trauma or emergency general surgery and surgical critical care, which is what I do, is being available to help someone when they're sometimes between life and death. And is the perfect remedy for burnout because it gives you a precise view of this is why you're doing everything that you're doing. This is why you're sacrificing. This is your late nights, your early mornings, you're skipping lunch for doing and improving the healthcare. You're doing it for people like this. So you can make a difference in a patient's life or in a patient's family's life. And that just brings it home. Is that remedy? No, it's like there's no better feeling that walking into a trauma room and knowing that you're going to be the difference in a patient's life for sure.
Yeah, I just got a little like chills a little bit. And I think it's really important for me as someone who's not a clinically trained, a technologist, right? But someone who works very actively in healthcare, um, to stay close to this, right? And I think it's one of the reasons that, a number of years ago, we really start relating to more practicing physicians. And luckily, I live in my mother-in-law is a nurse at New York Presbyterian, and she's in our building, and so I'm close to that. But it's important for me to stay connected to why I'm doing what I'm doing, right? It's not just uh we're not just innovating. We're the mission is to support these patients, right? So anyway, so Paul, I'm really excited, like I said, to have you here, and I want to learn a little bit more about you. I know that you're involved in numerous associations, clearly very humble, Harvard educated, right? Like I'm pretty stoked to have you. But where did you start out, and kind of how did you get to the point you are in your career today?
Well, thank you for the opportunity to talk about that. I think, well, my dad, I'm from Colombia, South America. And I grew up in Cali, Colombia, where, you now see it in Netflix with the Narcos series and everything that happened. And it's like interesting series for people to watch, but for us, it was our reality. And my dad is a trauma surgeon. He still practice. My mom is a nurse. And I grew up in that environment. And sometimes when they were busy and they didn't have childcare, they just took my sister and I to work. The first time that I scrubbed in a patient, I was 12 years old. I think I wanted to be around my dad, and I think I was bringing the nurses in the front desk crazy, so they put me in scrubs, and I basically just watching. And it was a patient that they were controlling bleeding, and the clamp move, and the blood like shoot to the sky, and I was like, wow, this is amazing. I'm made to do this. And I remember my friends making fun of me. It's like, oh yeah, all the girls have Barbies, and then Paula has the polytraumatized Barbie. And I was like, yeah, that's hilarious. But it's just like it was unusual, and it made me different for sure. But it was like I always say that I did not pick my profession. My profession picked me. It's just I couldn't do anything else with my life. I never have seen surgery as a job more than fun, as a calling, especially trauma surgery. I came to the United States through Miami. I did some research, um, worked for free a little bit, where a book the University of Miami, and I was lucky to find a spot at the Beth Israel Deaconess, one of the major Harvard hospitals. And it's just like it was like eye-opening experience to see the difference in technology, the resources for patients, and I always wanted to do whatever I could to give back to Latin America and places where there's nothing, right? And because if you think about patient care, it's like you're helping this patient here right now, wherever you are in the world. But if you can take that and make it into something that you can protocolize, and you can research, or you can make it that that has access to everywhere in the world, that you can bring the gold standard of care for patients where I needed the most. That always have been my dream. And then I went to Pittsburgh and did surgical critical care. Then I went to shock trauma Maryland and did acute care surgery. And then I have been working really hard since then to be in this position of division chief. But I think throughout that career, the most important part for me has always been helping patients, but also helping others, specifically women in surgery, because we are a little bit underrepresented. When like surgery is a field that is traditionally male dominated. Nothing wrong with male partners. Most of my mentors have been male, but I think trying to increase a little bit the diversity of gender and everything else, the diversity of thought, because that's how we can come up with great ideas, challenge the status quo, and finally, help patients in need, like at a larger scale, not a one-to-one, but on a larger scale. So that's kind of the summary.
Yeah, no, I love that. It's amazing that as I get older and, kind of evolve as a person, I realize how little I know, especially, we've started working a little bit more internationally. And there was a guest actually a number of months ago. Um, she was an executive at John Deere, and she would travel internationally and immerse herself in these cultures and bring it back and talk to her kids about it. And I've started doing that just because there's so much I don't know about so much, you know what I mean? And I think that, what you're talking about in bringing that diversity of thought, diversity of gender, for me, it expands my mind, and it's something that I want to continue to really be conscientious about. And, I'm excited that we can promote it today on this platform, just because I think it's so crucial, and it's easy for me to kind of be insular in my little world because, and even in technology, right? It's very, very male dominated. So how am I helping to, um, like I told my wife, like I want my daughter to like learn, but both, I have two daughters. I want them to like learn about technology. Maybe they'll be interested, maybe they won't, but um, or medicine for that matter. What would you say is one of the most important things that you learned over the course of your journey? And, if you're thinking about it, maybe what was life like before learning it and after learning it?
Oh, I hope this doesn't sound like too much like a Disney movie, but what I learned is that it doesn't matter how difficult it looks like. If you believe in your heart that you can do it, you can do it. And it might take you longer than other people. It might seem impossible, and some people are going to give you advice in things that are like that sound ridiculously hard, like dreams that you have for your life, for your institution, for what you want to achieve. Some people are going to say that's impossible, and then it's not a personal attack. They're just saying that because they're seeing that situation through their lens, right? So take the good things and forget the bad things. But I think through my journey, I learned a ton about people, and I learned a ton about medicine and leadership. But I think in general, throughout my journey, I think the most important thing, and if any advice that for anybody that is listening to this, dream big and believe in your heart that you can do it. Because if you believe it, it doesn't matter how impossible it seems right now. There's nothing that you cannot do.
Yeah. No, I mean, like it does sound a little bit corny, right? But I have the same feelings. You know, sometimes this is kind of embarrassing. Sometimes I'll watch Shark Tank, right, about these entrepreneurs, and I'll get like choked up. You can ask my wife. It's like it's funny, but it's because like I also had these dreams, and my wife like will call me like a dreamer. She's much more pragmatic, and but when I started out like with TI and everything else, like I really I we didn't have resources. It was very like, you know, uh, bootstrapped, so to speak, and we weren't sure if it was going to work out or not. And it's scary, right? I think uh, for me, like the flip side of that kind of dream big, or something that I need to keep in mind, right, is that um, it is scary to dream big, right? Like there's risk there inherently, and when I encounter different difficult situations, it can be scary. But for me, it's having the courage to push through that counts.
But I'm not saying like just sit there and only like meditating, dream only. I think what we're both saying is like you want to do something, then it's going to require hard work, and it's going to require sacrifice, and it's going to require getting out of your comfort zone, and it's going to require for you to invest time, invest emotion, invest money, and the key, if you really want it, is to not quit, right? And to do that you love, because that you said is true. Like it's gonna get hard, and it's gonna get scarred hard, and it's gonna get scary. But if you really love it, you're not gonna quit, because you need to find joy. I think in order to avoid burnout, like I don't think burnout comes from working harder or sleeping less. I think it's like you need to find the joy in everything that you're doing. And if you do that and you have joy, and if you love what you do, you will get there. It's just like everybody has a different path, right? I feel that some of the reasons why people quit what they're doing is like number one, they don't love it. Number two, that they basically see every obstacle as a defeat, failure, and that fear, that terrifying fear of failure, right? And then people start comparing themselves with other people in different journeys. But this is that, like I did a short video the other day for Instagram. You're never behind, because who are you behind of? Like you're like this is your path. Your path is different than anybody else's path. It's unique because it's yours, right? So you cannot possibly be behind. You're exactly at the place where you need to be.
Yeah, I love that. I'm glad you bring that up, because and it actually kind of it dovetails into my next question, and we were kind of talking about this offline, but everything, the good, the bad, the ugly that I've experienced in my life, has led me to the point in time that I am at today. And, I have a beautiful life. So, I'm incredibly grateful for that. Paul, is there a time that sticks out in your mind that, you failed, or you had a personal, professional, um, obstacle that was significant, but ultimately coming out of it now, you can see how it had an impact on your life and your development as a person?
Not one, multiple. When I first came to the United States, I came to Miami, so it's a little bit easier in terms of language because everybody spoke Spanish. But nobody will even give me the opportunity to rotate into surgery. It was not allowed. I couldn't touch patients. People used to tell me, like, if you want to stay in the United States, you need to quit. You need to quit thinking that you can be a surgeon. And I'm like, okay, well, that's your perspective. It was I thought at the time it was nearly impossible, and I did a ton of stuff and to try to stay in Miami. It didn't work out, but at the time I thought it was defeat, but yet it wasn't, because I was never dreaming in my life that I was going to graduate from a Harvard program. So I got the opportunity to do that, and every step of the way in Boston was like to prove myself. I think that the weather was more difficult. I still have an accent. I had to modify many things that I did, and how I like not change yourself, but like coach yourself to be able to be part of the culture and for people to understand where you're coming from. I did not understand it at the time, but I think I struggle a lot with trying to fit in. I think it took a while for me to like learn who I really was and be secure in who I was. So I didn't have to like struggle to fit in, but actually find an environment where I felt that I belong. And it wasn't until recently that I like read all this stuff from Brene Brown that I was like, yes, I know exactly what you mean. And then when I wasn't attending, sometimes you have people are that are supportive and they're helpful, but sometimes you find people that actually do not want you to succeed, that on purpose do things to block your success. And it took a while for me to understand that it's not personal. Even when it's an attack, that is an attack towards you, it's not about me. It's about the other people's insecurities. And and that's also hard. It's like it takes personal coaching and emotional um investment, right? In not because even though we all recover, and that actually makes you better, and then it makes you wiser and you're grateful for it once you go through it, you still have to recover from the moral injury that those interactions have. When people do things not with the best intention. But all is good because it works out at the end if you stick to it. Like these there's I'm sure you have seen it already. There's this book that says the hero of 1,000 faces, where basically this describes what happens with a hero. It's like the hero gets what is in a status quo normal, then gets called to action, finds mentors, goes to battle, has to slay a bunch of dragons, nearly dies but recovers, and then when it recovers, then now you have your prize because you're a hero, and your new status quo is as a hero. And that's like mirrors every movie that we have watched of Hunger Games and Superman. But if you look back in life, that's what we do. That's what we do from, when you go to high school and you become your own hero, and when you go to graduate school, and if you leave your country to another country. Um, the key is when you're going through the trials, right? When you're slaying the dragons, that's when it feels like more isolating and you're in crisis and it's hard to go through. But that is when you have to have own yourself the most, because that is when you have to not quit. Because when you go through that, that is the actually achieving the better version of yourself, even if it's not a paper, a title, or a trophy or something physical that you got. Once you go through that, you are at a different emotional, mental state. And that is priceless. There's no university, there's no book, there's nothing that can fill in for that. It's a personal journey.
Yeah. Wow. Super profound. And I also love Brene Brown. I have the man in the arena quote like right behind my desk. No, super cool, Paula. I actually, so I want to get into a little bit more about the work you guys are doing at Inova and maybe some of the other initiatives you're working on. Before I do, I mean, you just brought up a good book. Any other favorite books, either that you've read recently or that all time? Anything that comes to mind that you'd want to share with everybody?
Well, I love reading. So I read obviously a lot about medicine, but and now I drive a lot, so I listen to audiobooks because I don't have like the time to sit down and read. But many books, Presence from Amy Cuddy, Multipliers, The Atlas of the Heart from Renee Brown. There's many books that are super interesting and enlightening, right? Yeah.
Department Chief of Trauma Surgery, right? At Inova. Talk to me, Paula, a little bit, because I see you all over the place, right? And you're clearly trying to, make an impact, both like you said, kind of in your world and at Inova, but then also how are you kind of propagating, what you guys are doing, kind of to help others outside of even your immediate reach. Talk to me a little bit about your vision for the organization and kind of some of the key things that you're working on right now.
Yeah. So I think the special part of my job is, I mean, I love the part of being division chief. That's wonderful. That's great. We have a division in a hospital where we're really hard. We work in changing the culture. We are people that now are really truly a team that depend on each other, and we help the sickest patients in Northern Virginia. But then the second part is creating a trauma system. Trauma systems save lives. If you are a patient and you end up in a place where it's not only a standalone trauma center versus a trauma system, your chances of dying are 20% less than if you didn't. And then there's different levels of trauma centers. There's the level ones that deal with the sickest of the sick, 24/7 ICU care and immediate availability to blood and blood products, the trauma surgeonal like there all the time. We do research, we do education for the community. We do trauma prevention initiatives. We educate residents, all of that. There's a level two, which clinically is very similar, but without the research and the trainees. And there's a level three, which is basically receiving patients that are a little bit less injured, but sometimes patients are more injured than the capacity of the centers get there. And when that happens, if you're in a trauma system, you can refer, you can share data, you can share protocols. So in that way, you actually improve patient care overall. And I think like what you mentioned, yes, doing things that writing guidelines, writing things that will help patients abroad. I think with the currently with the opportunity of being president of the Pan American Trauma Society, we have the opportunity to have a educational exchange from North America to any place in Latin America to be able to share experiences. We have these case discussions weekly or bi-weekly sometimes about, how would you treat the patient if you were, in a rural place in Peru or in Brazil versus in the United States. And it just opens people's minds about like the possibilities, different possibilities with less resources and more resources. And you will think like, how does that help us in the United States? There are places in the United States where the human resource is very small. Like we talk about trauma, and yes, there's many in bigger cities. The trauma patients go to tertiary care centers, level one trauma centers, that urban trauma centers. But in the middle of the United States, all the trauma patients taken care of, sometimes not even by trauma surgeons. Um, so that is where we can collaborate with also the international experience, because it's not that different to be in the middle of the United States and to be in a rural place in Peru. If there's no resources, there's no resources. We saw it, for example, with COVID. It was the first time in the United States that you had to triage who you gave blood to. And everybody was horrified because, oh my God, you have to pick who has the bigger chances of survive. Guess what? There are places in the world where that triage happens every day. So I think that in terms of education and improving patient care, having a global vision of it so we can benefit from each other's experience ultimately helps the patients, wherever they might be. Because if you have trauma surgeons that have that mindset of like, your way is not the only way. There's ways of doing it, and then have that capacity of having that mindset, but also the opportunity to discuss these cases where they have no research. Ultimately, the patients are the ones who benefit.
Yeah, no, 100%. I mean, I had the opportunity to learn more about um, the healthcare system in India a number of months back. I was actually supposed to go and just, I know you're talking more kind of about the clinical, triage methodology and stuff like that. Uh, for me, just in general, because I'm not as clinical, obviously, as you, but like learning about how in India, just the system is such that like if I'm a person and I need to receive care, I can go to, you know, Dr. Smith, who's like the best doctor in the area and pay $1,000, or I can go to Dr. Susie, who's like, kind of 50th percentile and pay, half that, or I can go to this doctor and like it's very consumer driven, which was interesting to me, right? So it's different because the insurance isn't like all mucked up in it, right? And it was just very eye opening to me to have a consumer driven system like that. Not to say it's better or worse or right or wrong. It's just it helps me kind of just expand my horizons and learning more about like the NHS in the UK, right? And how all of that works, which is again not better or worse, but it's just I think it's important for me to continually just try to be a student of the world and like and learn more because it's going to help me serve the person that is in front of me, the less ignorant I am, in general.
100%. Like, and that model that you're talking about in India, it happens in many places in Latin America. Many places in Latin America, they don't have a 911 the same way that we have here. So if somebody's sick, either a family member drives them or you have to contract a ambulance. And so the time between injury and care is different if you then have resources versus not having resources. All of those things are eye opening. And also it helps me really be grateful for the amazing things that we have in the United States.
For sure. Um, and I also meant to mention, you were talking about the trauma system, right? And it got me thinking about systemness. And I had the opportunity to participate in a forum at the National Academy of Science, Engineering, and Medicine in DC, surrounding traumatic brain injury, right? Which what is often maybe not level one trauma, but like is taken care of at a acute care facility, and how am I promoting better follow-up care for patients that have had TBIs? How, because often what'll happen, right, is a patient will come in with the TBI, they'll be treated in acute care setting. Maybe there's no immediate follow-up care that's necessary, but then 6 months later, those symptoms appear at that time. And then if they're not kind of tethered, they end up kind of floating off into the ether and having these issues. And basically, how am I building more systemness? And so it's just exciting to hear that that's what you guys are working towards, because I think it's crucial for a number of different reasons. Yeah. What are some of the biggest challenges you guys are facing right now, Paula, as a system?
Well, I think that there are many challenges. I think that standardizing the care in different centers is sometimes hard. I think that I believe that managing teams, the most important thing is presence, right? So I think as a You have to trust the leaders that you have in every institution to do that, but you still have to be able to be present. And then there's only 24 hours of the day and 7 days of the week. So it's hard to maintain that presence. There's ways to do it that is not physical, but you still have to roll your sleeves and boots on the ground to be able to earn that respect and earn that trust from the team. There's some people that don't want trauma programs to be built because they see their hospitals as small community, like very boutique, and and some people don't just they just don't want they don't welcome that, and that's a I think the difficulties in general for any new thing is to try to change the mindset of people to help them see how is it going to benefit the entire community, right? A lot of listening is involved in that, a lot of understanding where people are coming from, and try to create situations where we all get to get something out of it. So win-win situations will be great.
Yeah. I mean, I feel like you're describing the tenets of like successful organizational change management in healthcare. Is like, for me, it's like, how am I making those colleagues feel heard, feel seen, you know? So yeah, 100%. I think it's relevant to what you guys are doing and a number of different things that are going on in the industry. How about, Paula? Are there any technologies that you're, excited about that are going to impact the work that you guys are doing?
Well, tons of it. I think that we yet to see how AI is going to help us do better and be more effective. I know there's a ton of reservation everywhere, not only in medicine but everywhere about AI. But I do think it's about how we use it, and there's always, I think it's human nature to be afraid of change, right? It's something is a reason why it's evolutionary. That's how we are still alive after thousands of years. So I think that that is going to be an interesting thing for all of us in healthcare. I think so. The trauma resuscitation used to be airway, breathing, circulation, and now we're trying to change it. And this change is actually coming from Inova. We're trying to recognize that for patients with penetrating trauma that are bleeding really rapidly, probably intubating first is not a great idea because it causes physiologic rearrangement that decrease the perfusion, the blood supply to the brain and to the heart. We believe and I mean, we said not only me, there's people also from Chicago that are helping, from Louisiana that are helping, from shock trauma that are helping, from Pennsylvania, all centers that have high volume of penetrating trauma. In Latin America, the same. In Latin America, they have been practicing this for a while. So we are trying to. It's not technology, but it's a different in mindset, and it's a conjunction of things. Instead of doing ABC, doing CAB and giving blood earlier and delaying intubation until you start resuscitation, perhaps do procedures that will slow down bleeding that will help give you a little bit more time to save the patient's life. So that's a paradigm that we're trying to change. We're on the way of doing it, I believe. Yeah, many great things to come from collaboration.
For sure. Um, Super exciting, Paula. And it kind of leads into my last couple questions. First would be, where do you see the healthcare industry kind of going in the future, with the understanding that you don't have a crystal ball, but what do you think will be some of the biggest changes as time passes, or what do you hope will be some of the biggest changes as time passes?
In trauma, in the system, in the world,
Either is fine, right? Whatever anecdote you think you want to share with folks.
I think the biggest change that needs to happen in general in trauma in the world in medicine is allowing us to ask questions. So there's like, even if there's no data, if people have been doing things the same way every day, there's like an incredible resistance of thinking outside of the box. And I don't know why. Maybe it's my bias that I see that this is more obvious in medicine and in surgery. It's like people have been trained to think this way, and pausing for a minute and saying, wait a minute, maybe this is not the right way to do it, then it comes with a lot of resistance, even if what you're doing is 100% not backup for data. So I think giving people the opportunity, and again, maybe something that AI will help us. Like if there's more, if there's some things that can be taken care of, not necessarily by us, and giving us more time to not shut down our brain's creativity, because we are in life and in medicine and in surgery, we're doing, and then sometimes you forget to think, you forget to question, you get to give yourself time to be creative. But you need creativity to solve problems. You need creativity to change the status quo. You need creativity to advance medicine and surgery. So I think that that's the biggest change that needs to happen is that increase diversity of thought, increase inclusion of people, different thought process, and be okay with healthy conflict, so we can all come up with innovative solutions for problems that maybe sometimes we didn't think they were solvable. I think that that's where we need to go. That's where we're going slowly, but that's where we need to go.
Boom. Love it. Um, so cool. Paula, this has been amazing. Um, the last question I'd have for you that I like to ask all my guests is just if you could go back 10, 15, however, 20 years in time, what advice would you give your younger self?
Number one, don't quit. But I did that. I didn't quit. I think I would be like, um, I would tell myself, it's gonna be okay. Because I think, and I said this before, it's gonna be okay at the end. If it's not okay, it's not the end. I think that when we have a passion project and you really want things to happen, and it's okay, you're gonna persist, but the emotion associated with sometimes feeling defeated, right? And the nights that you didn't sleep, the times that you cry either in the outside or in the inside, and the time you invested on that, you're never gonna give that back. You're never gonna get that, right? The stress that you felt, maybe the gastritis and ulcers that you have because of it. That's you're never gonna get that back. So I think if I could go back to myself and say, take a deep breath. It's gonna be okay.
Yeah, I think my younger self could have used that advice too. So, thank you, Paul. This has been great. I really appreciate you taking the time today.
It was delightful. Thank you so much, David, for inviting me.
Absolutely. And to our listeners, thank you for tuning in, and we will catch you all next week.